Good afternoon and welcome. My name is Herbert Band. I'm very pleased to offer a warm welcome on behalf of Access Accelerated, which is a unique collective effort of innovative biopharmaceutical companies that have pooled their resources to help countries address the global challenge of NCDs, including mental health. Since 2017, Access Accelerated has worked with various global and local partners, one just walked in, to provide financing and technical resources to expand access to quality, affordable care for people living with NCDs, focusing on low middle-income countries. Our partners have included the World Bank, NCD Alliance, City Cancer Challenge, World Heart Federation, and PATH. Many of them are here today. And most recently, we've been pleased to collaborate with the World Diabetes Foundation. We're very proud of our collaboration with the World Bank Q and country teams over the past 7 years. And it's great to have Ken Hansen from the World Bank with us today. Thank you. To date, World Bank tools, investment cases, and pilot projects funded and supported by Access Accelerated have helped to catalyze over $4 billion in financing for NCD prevention and control. Very soon, we're going to release a comprehensive report detailing our 2023 activities and outcomes with the World Bank and country partners. It's really important to spotlight these stories and share what works and what doesn't so that we can all improve and accelerate our efforts. Looking ahead, we're very encouraged by recent statements from World Bank President Ajay Banga, who you may have seen together on stage with Dr. Tedros at the spring meetings. He said that the World Bank Group aims to expand health services to 1.5 billion people around the world, including people living with NCDs, and develop new financial instruments that will boost the bank's lending capacity and ability to multiply donor funds. Very exciting. But Ajay Banga acknowledged that achieving this ambitious target cannot be done by the World Bank Group alone. Partnerships are crucial. We all know that addressing NCDs is a long-term effort, and we're committed to achieving the SDG 3 global health targets in 2023 and beyond. Reflecting this commitment, Access Accelerated is very pleased to be launching a renewed partnership with the World Bank to support governments and local stakeholders in LMICs to develop effective ways to improve financing for NCDs. This is really a local empowerment model supported by Results for Development, who you'll hear from in a moment. It's really designed to respond directly to country needs and requests for technical support, for country-to-country learning opportunities, which we heard about yesterday, and programmatic seed funding. We plan to establish a network of regionally based NCD Financing Accelerated, hosted by local institutes that will support the advancement of the regional agenda for NCD financing. And we know that financing for NCDs is perhaps the most significant gap in the NCD response. We heard that yesterday from Bente Mikkelsen. You'll find a sneak peek at the new model in the document before you, and you'll be hearing more details soon. Why is all this important? Why are we here, other than it's lunchtime? We all know the dramatic statistics about NCDs and the large and growing health, economic, and personal burdens they cause. We know that countries are asking for help on NCDs. And we know that the resources devoted to addressing NCDs at global, national, and local levels are minuscule compared with the magnitude of the problem. We've been talking about these issues for many years, and I know some people in the room have been involved at UN high-level meetings in 2011, 2015, and 2018. In 2018, we had a first global dialogue on partnerships for sustainable financing of NCD prevention and control. And some people here were instrumental in setting up that event. It was an important event and a step in the right direction. And yet the WHO recently pointed out the following challenges. Number one, these events raised political awareness, but did not result in sufficient resource mobilization to translate high-level commitments into action at a country level. Number two, reaching SDG target 3.4 will require bold changes in domestic and international financing mechanisms to scale up actions against NCD and mental health conditions and provide funding for best buys that have been identified. Number three, integrating NCDs and mental health into universal health coverage packages requires policy and institutional changes and strengthen capacities for ministries to engage all relevant stakeholder groups across government, civil society, and the private sector. Here's a call to action for today. We all need to work together to address these challenges. Yesterday evening, Access Accelerated, together with NCD Alliance and World Diabetes Foundation, co-hosted an insight-filled event that engage governments and other key stakeholders 3 weeks ahead of the WHO World Bank Second Global Dialogue for the Sustainable Financing of NCDs and Mental Health in Washington, D.C. We had an excellent discussion that included presentations of 4 successful national examples of financing for NCDs and mental health. For today's discussion, I'm very pleased that we have a distinguished guest speaker from Kenya, from the Ministry of Health, who you'll meet in a moment, who'll share with us their impressive initiatives and their ongoing local needs and challenges. We're also fortunate to have a diverse group of organizations join us today. And I won't list them all in the interest of time, but we've got the World Bank, IFC, WHO, leading NGOs, innovative financing organizations, impact investing organizations, as well as pharmaceutical and medtech companies. This really gives us a unique opportunity today to hear from and learn from all these organizations. Let's take advantage of all your experiences, your battle scars, your hard-won successes, and share some concrete ideas that have the potential to move the needle on NCD financing. Let's take these ideas into the second Global Financing Dialogue, as well as the 2025 UN High-Level Meeting on NCDs, to find ways to launch or scale them up. So I'd like to ask us to consider a couple themes for today's discussion. First of all, improving financing for NCDs and mental health as part of UHC includes both mobilizing additional resources and optimizing country-level spending on interventions that demonstrably improve patient health outcomes and health system performance. So we look at financing in a very broad sense. Number 2, providing financial protection for patients really requires a variety of different measures that may vary country by country. This could mean strengthening domestic revenue-raising measures and investments. It could mean World Bank and Regional Development Bank financing, private sector financing, global donor funding, development assistance for health, innovative financing models, health insurance models, and last but not least, leveraging prior investments in infectious disease infrastructures to also address NCDs like hypertension and diabetes. To achieve our collective goals, we're going to need to develop all of the above and offer them to countries so that they can select the tools that work best at a local level. And we need all stakeholder groups, including the private sector, working together. Last point I'll make is we really need to listen to the voices of local leaders and stakeholder groups who can tell us about their local needs and identify the solutions that will have the greatest local impact to make a positive, lasting difference for communities and people living with NCDs. So anyway, on behalf of Access Accelerated, I appreciate you all being here. I look forward to today's discussions and our joint commitments to take action. Thank you for being part of this critical discussion. And with that, I have that pleasure to hand over to Gina Lagomarsino, the CEO of Results for Development, who will introduce our guest speaker. Gina, please.
Hi, everyone. So nice to be here today. And R4D is really excited to be getting involved with Access Accelerated as the new network manager. Our mission is to support change agents who are building strong systems for health. So I'm very excited today to introduce Dr. Elizabeth Wangia, who is a major change agent in the country of Kenya. She's a medical doctor who's been with the Ministry of Health for, I think, 18 years, she mentioned to me, and she has a whole host of degrees behind her name, but I won't list all of those right now. Most importantly, Dr. Wangia has really been leading the effort in the last few years on universal health coverage in Kenya. So her purview is very broad. She's been involved in a number of pieces of legislation that have recently passed and some that are still pending, which are very, very exciting. And as a part of that, NCDs have been coming out as a major priority. And so today we're going to talk about that, although she could talk about many, many different topics. But maybe we could get started, Dr. Wangia. Can you talk a little bit about the current burden of disease in Kenya? I know many people in this global health space sometimes think that it's still all about infectious diseases. That has already changed significantly in Kenya. So tell us more what you're concerned about in terms of the burden of disease at this point.
Okay. Thank you so much, Gina, and for the organizers for giving me the opportunity to share Kenya country experience with this group of esteemed members. As you correctly say, I could speak a lot around all the reforms that are happening in Kenya in terms of UHC, but I'll focus my discussions this time on non-communicable diseases because that is the topic of interest. As a country, Kenya, we are still burdened with the burden of communicable diseases. It's still a big problem, especially TB, malaria, HIV, and of course also we have the neglected tropical diseases. But in the midst of that, there is a rising burden of non-communicable diseases, and it's mainly due to lifestyle changes. We are becoming more modern. We sit more in offices. We use vehicles more than walking than we used to do before. And we're also living longer. So with that, the burden of non-communicable diseases is quite significant. And it's acknowledged that we are actually undergoing an epidemiological transition where we now have a triple burden of disease. And with that, we know also that if you look at the leading causes of mortality in Kenya, communicable diseases are amongst the top leading causes, especially cardiovascular diseases. Then we also have the cancers, amongst others. And therefore, it's a priority for us. Because of that, we got also a lot of political will, right from the president, acknowledging that this is a burden. And therefore, we have, yesterday I was in a session where you were wondering how you can get top political support. As a country, we have the highest political support when it comes to management and financing of non-communicable diseases.
Wonderful. Well, thank you for that. And you were mentioning earlier that the president in his campaign was really talking a lot about non-communicable diseases. So that's great that there's a lot of domestic will to move forward on this agenda. Now, addressing non-communicable diseases, both prevention and treatment, is not cheap. It's expensive. So how are you thinking about financing for this in the context of your major reform efforts that you're going through? I'm curious how much resources you've already been able to bring together and what those gaps are and how you're just generally thinking about the financing going forward.
Yeah, so NCDs have still historically been underfunded, given that when you look at the total health expenditure within Kenya, only 11% of the total health expenditure goes to non-communicable diseases. Nonetheless, and this 11% actually accounts for 6%, based on what we expect in terms of financing, it's just 6%. We have a 94% funding gap if you look at the expected financing for non-communicable diseases. And the steps that have been taken are around integration. And the one key thing within integration is seeing how can these non-communicable diseases be incorporated within what you call the health benefit package. Right now, we have what you call the social health insurance. Last year, we passed the Social Health Insurance Act that mandates all citizens of Kenya to enroll to a social health insurance. Within the Social Health Insurance Act, we have 3 funds. The first fund is the Primary Healthcare Fund. So Primary Healthcare Fund, the main purpose of that fund is actually to fund primary healthcare services at facility level. And here we are looking mainly at preventive, promotive financing, but specifically we are also financing a screening for our top causes of cancer. And here we are looking at breast cancer, cervical cancer. We are supporting via VLI and HPV for colon cancer. At least at primary level, you should be able to do the test for occult blood, and also and of course, given that the HPV vaccine is also part of our normal routine vaccination. So with that, we are seeing that this will be quite impactful. And also, currently we are supporting the community health promoters. We used to call them volunteers, but right now we are paying them some stipends, and also we have given them the necessary kits. Right now they have blood pressure machines, they have glucometers, they're able to do all that screening at community level, and that is financed directly by the government. The Social Health Insurance Fund is the second fund within the Social Health Authority, and this one mainly finances NCDs, of course, all other conditions, but specifically for NCD, the main thing that's there is around oncology care. Previously, we could limit the oncology care, but this time we are financing treatment plans so that we at least we ensure that if we are supporting a patient, then we see the patient through till the end. Because we could support, initially we could support sessions, then the patients could not afford subsequent sessions. But then we could come back and support them when they are complicated because we are still able to support complications. So we realize that the best is to look at what is the entire treatment plan and support that. Still, that fund is the Emergency Chronic and Critical Illness Fund, which is specific for chronic diseases, which could be both non-communicable and communicable. But the whole plan is eventually wish that fund should be able to finance the chronic diseases. We know that chronic diseases, insurance works based on a model of risk. Chronic diseases are not, they are definites. So, and that is the reason behind, financing this through a fund, because we know that definitely that's a sick fund. We'll never get, there is no one cross-subsidizing the other. Everyone there is sick, and therefore we need to fully plan for them based on data that we have. Once we know that this is the population in need of maybe hypertension treatment, diabetes, and the like, we plan for them.
Fantastic. Well, it's very exciting to hear about that effort to integrate NCDs into so many aspects of the health system and all these different funds that you're launching. Maybe you could talk a little bit. I mean, this is all, the plan sounds fantastic. Getting plans like this implemented is not always the easiest. Can you talk a bit about some of the challenges you're currently facing that you're trying to address in the implementation of this?
So for us to have, thank you for that, for us to have adequate resources to finance all these conditions, one will need actually 85% of the population. Our target is to have 85% of the population enrolled in insurance so that we have a large pool that is able to cross-subsidize. Because as we speak right now, most of the time, people only enroll in the insurance when they know that they are sick. You have been diagnosed with cancer, hypertension, the first thing people do is go and enroll in the insurance. Therefore, we have had adverse selection, and therefore we have been unable to have a situation where there is cross-subsidization of the sick with the well. So a lot of efforts being put around ensuring that we raise our insurance coverage from 26%, the current 26%, to the expected 85%. And with that, we can be sure that there'll be a whole mix of people, and therefore we'll be able to finance health. And with that, we have looked at initiatives such as use of the cooperatives, because Kenya, as a country, the formal sector is only 20%. So we have an 80% of informal sector. And informal sector doesn't necessarily mean poor. It just means we don't know where they are. They are busy doing their own businesses here and there. So we are looking at what are these initiatives that we can put in place to get. We had even proposed, though this was contested in court, we are hoping it can be lifted, that for any business, however small, they always have licenses. So for you to get your license, you have to show that you are a health insurance. Even school-going children, for you to get into school, you have to show that you have a health insurance. So we are really hoping that that case can be lifted. It was, as I said, it was contested in court. And with that, we should be able to raise the numbers. And of course, just being able to advocate based on the benefits of insurance. There's a lot of, I would say, either lack of information out here on what an insurance is all about. And probably if someone pays for insurance 2-3 years, they don't fall sick, they may end up saying, okay, my money is going to waste or something like that. So just that community sensitization is important so that people know that it's a matter, it's all about solidarity, that when you are well, you can actually pay for someone who is sick. So I think that's one approach that we are looking at.
Absolutely. I think we all know that the best way to pay for healthcare is to get everyone to contribute in some way, either through taxes or getting them to enroll in social health insurance. It's very exciting that Kenya is moving towards this model, although it's not easy to get everyone enrolled, as you know. I am actually curious, since we've got lots of partners here from various different institutions, the private sector and global institutions, how are you seeing the role of development finance in what you're doing? Clearly, domestic financing is the key here that you're focused the most on. But any thoughts on other kind of innovative financing mechanisms, ways to integrate other sorts of financing to support the expansion of these broad benefit packages?
Yeah, so for us, one thing that when it comes to partners, the key thing that we would really desire is for there to be an alignment when it comes to our priorities, so that if we choose that we want to do maybe a given intervention, you support us to do that intervention at scale, so that we avoid a lot of pilots. And because sometimes when you have all the pilots, you may find that showing impact as a country becomes a challenge. Then, as I said, also through some of the interventions such as screening and early treatment, say, of cancers. Right now we have introduced LEAP and cryotherapy within the package, just seeing how the partners can come in to support some of those interventions in terms of even equipment. We have especially infrastructure and equipment that will at least help us move forward. But the main thing moving forward is just to see how we can come together and support interventions to scale. Then the other approach could be innovative financing mechanisms. We have seen situations like impact bonds, and those ones can be done even, say, at subnational level. Maybe you identify a subnational level that has a high burden of NCDs and see how can you maybe support in that way, so that through, I would say, like impact bonds or social contracting, whichever way that could be used to at least raise resources and also have impact. Result-based financing also has been one of the areas where which we have seen in the past to have succeeded, especially when we had a high burden of around maternal and child health. There were quite a number of initiatives around result-based financing that really helped to put achieve some impact and move the indicators further.
Very interesting. Well, I hear a key message there that you're interested in innovation and you want to make sure it's integrated with the overall government plan, not fragmented pilots and things like that, which is very exciting. So maybe a final question. I think, how much time do we have left? A little bit. Okay. So part of what Access Accelerated does, in addition to sort of identifying innovations and supporting you, is to support more kind of regional learning around what is working. And I'm curious if you see a role. I think Kenya will be a learn from country for a lot of other countries in the region. But any thoughts about how we can structure regional learning or global learning that will be helpful to you in understanding what really works in financing for NCDs?
Yeah, I think if I may just think around how this has maybe worked even in other programs, it's through collaborations. If there are platforms where you can have collaboration, I know even through the World Bank, there's been this, like, say, the Joint Learning Network, where at least you bring in people of a certain interest where they can share ideas from, ideas on how their successes, their challenges. We don't always have to learn from successes. You can also learn from challenges and bad practices, so that shouldn't be actually adopted. So I think such sessions would be good. And then just the fact that in the NCD space, getting data is a challenge. So just also promoting research, just so that this research can actually form a tool for advocacy. And one last thing that I didn't mention, where the partners could also come in strongly, is around advocacy, because advocacy, I've seen, is one area that can really move a lot. And as I just shared with you before, for instance, for us in Kenya, there is one time when the then Minister for Health, got prostate cancer, and that's one thing that actually made it a national priority. Because it was personal, and for sure, personal stories actually move needles. So that advocacy is one area that we cannot take for granted.
That's great. Well, you'd never want anyone to get cancer,
No.
but if it's the Minister of Health and it can lead to advocacy, that's a silver lining. Well, I think we are out of time here, but I think that gave us lots of food for thought to structure this conversation going forward. So please join me in thanking Dr. Wangia, and we wish you luck in all of your efforts. This is a lot to do, but I'm really, really excited that you could be here with us today. Thank you.